My name is Julie Lord, and I'm a licensed independent mental health practitioner at ESU3 here in Nebraska. I've been working as a licensed clinician in Nebraska since 2010, and I've had the privilege of working directly in schools since 2016. The goal of this segment is twofold. First, to briefly review the key points from the previous signs and symptoms of trauma video in this series. And second, to learn more about the elementary signs and symptoms of trauma, and to look at how to implement trauma-informed strategies into our day-to-day work. Let's begin by defining what we mean by trauma. Trauma refers to an event or series of events that is experienced as physically or emotionally harmful, often resulting in lasting adverse effects on a person's functioning and well-being. As educators, we are on the front lines of supporting student mental health. Every day, we work with students whose experiences, both positive and negative, shape their behavior, learning, and well-being. While many of us recognize that some students bring emotional burdens with them to school, you may find it surprising that 62% of adolescents in Nebraska report having experienced a potentially traumatic event in recent years. Understanding the different types of trauma. So now that we have defined trauma, let's take a closer look at the different types of trauma that students and even educators may experience. These include acute trauma, which results from a single event, such as a car accident or natural disaster; chronic trauma, which stems from repeated and prolonged experiences, such as ongoing abuse or domestic violence; complex trauma. This often occurs in caregiving relationships and involves sustained interpersonal harm during development; historical or intergenerational trauma. This type of trauma impacts entire communities, often rooted in events like colonization, forced relocation, or systemic racism; and secondary or vicarious trauma, which arises from exposure to others' traumatic experiences. A reality not just for mental health professionals, but also for educators and school staff. It's important for educators and school systems to share common language and understanding about the different types of trauma. Having that shared understanding helps schools better identify and support students whose trauma may be affecting their academic success or social interactions. National data tells us that 1 in 6 youth between the ages of 6 and 17 experience a mental health disorder each year. That's why this training includes not only new insights, but also practical classroom-ready strategies to help you recognize when a student may need additional support and to know what to do next. Trauma doesn't just affect how a student feels, it also affects how they learn and behave. When a child experiences trauma, their brain may activate a fight, flight, or freeze response, an automatic reaction to perceived danger. This stress response can interfere with the brain's prefrontal cortex, the area responsible for higher-level thinking, problem-solving, and emotional regulation. Imagine trying to learn math while a fire alarm is going off. That's what it can feel like for a student trying to learn while in a state of distress. Common trauma-related symptoms include intrusive symptoms, such as flashbacks or distressing memories; avoidance symptoms, like steering clear of reminders or situations; mood changes, like negative thoughts, depression, or emotional numbness. It's important to note that not all children who experience trauma go on to develop PTSD. In fact, 3 in 4 children do not. That's where educators and schools have an incredible opportunity to make a difference. Positive school experiences, strong relationships, and even something as simple as meeting a student's basic needs, like food and safety, can promote emotional resilience and protect against long-term effects. As educators, it's essential that we know how to recognize the signs of trauma in our students and to respond with both empathy and consistency. Now that we've reviewed the key takeaways from the first video, let's take a deeper look at the impact of trauma in our schools. As educators, we often hear about the importance of meeting the needs of every student who walks through our door. We serve as content experts, instructional leaders, and more as we juggle our many roles every day. We educators witness firsthand the struggles students face both inside and outside the classroom. And yet, sometimes what we see from a student is just the tip of the iceberg, the visible behaviors or challenges that they present. What lies beneath the surface, however, can be far more complex and impactful. Just like each of us, our students are shaped by what is unseen beneath the water, things like stress, fear, grief, and unmet needs, all of which can influence how they show up in the learning environment. In this segment, we'll explore what might be floating beneath the surface for students, the root causes of behaviors, disengagement, or emotional responses that can sometimes be misunderstood. We'll also consider how these factors might look different depending on the student's age or stage of development. As we discussed earlier, mental health and well-being are deeply personal, but they're also shaped by the environments where we spend our time, at home, at school, and in our communities. As a profession, education is becoming increasingly trauma-aware, making important shifts in our understanding and practices to better support students' well-being and academic success. As an adult who cares for our youngest learners, you know that young children don't always have the words to tell us when something is wrong. They may not be able to name big feelings or describe difficult experiences, but they often show us through their behavior. That's why it's essential that we pay close attention. Behavior can be one of the clearest ways that children communicate their internal world. Let's take a closer look at some of the ways trauma might be present in preschool and elementary age students. Regression in behavior. We'll begin with regression, which is often one of the clearest early indicators that something is wrong. Imagine a student who was once confidently independent, suddenly becoming incredibly clingy, not wanting to leave your side or the side of their trusted caregiver. Or maybe there's a child who has mastered toilet training and suddenly starts having frequent accidents. Some children may revert to baby talk, using language and displaying behaviors that they had previously outgrown. While these may seem small on the surface, they can be significant indicators that a child is feeling unsafe or overwhelmed, disrupted developmental progress. Another area to watch for is developmental progress. Sometimes trauma can interrupt a child's growth. You might notice that a student who was thriving begins to fall behind developmentally, struggling in areas where they once excelled. Processing through play. Play can also provide important insight. Children often process difficult experiences through imagination and storytelling. If a student begins to reenact distressing events in their play, draw unsettling pictures, or repeatedly talking about something upsetting, it may be their way of trying to make sense of an experience that they can't fully understand. Sleep disruptions. Trauma can also disrupt sleep routines. A child may refuse to sleep alone, wake frequently during the night, or complain of nightmares. This can be especially noticeable with pre-K and kindergarten students during nap time or rest periods. Physical symptoms. We should also pay attention to physical symptoms, which can often accompany emotional distress. Headaches, stomach aches, and even an exaggerated reaction to small bumps or bruises can be a signal that a child's nervous system is on high alert. Behavioral changes. Behavioral changes are another area to observe. Ask yourself, has their appetite changed drastically? Are they withdrawing from activities they usually enjoy? Are you seeing more angry outbursts or increased difficulty focusing? Do they seem quieter, more irritable, or emotionally flat? Heightened fear or anxiety. Sometimes trauma shows up as heightened fear or anxiety. A student may become preoccupied with their safety or the safety of someone they care about. New fears may emerge, such as fear of the dark, animals, or imaginary threats like monsters. In more serious cases, students may begin to express thoughts or ask questions about death and dying. And finally, trauma can make children highly sensitive to their environment. A loud school bell, a slammed locker, or even a gentle touch might cause a student to become overwhelmed. You may notice that a child overreacts or underreacts to everyday sights, sounds, and sensations. The important thing to remember is that these behaviors are not bad or misbehaviors, they're messages. They're a child's way of telling us, I need help, even if they don't yet have the right words. With the right support, many children begin to recover within weeks or months. Others may need more sustained support. That's where educators, caregivers, and mental health professionals can work to create a positive path forward together. Trauma can manifest in many ways, and some of the most serious impacts may be invisible to others. That's why it's so important that we remain consistent and intentional in our approach. While every student's needs are different, here are some key strategies that we can use to support children and adolescents who've experienced trauma. Create safe spaces for open dialogue, provide trauma-informed counseling or referrals, teach self-regulation and coping strategies, help students reestablish a sense of agency and hope, and involve trusted adults and caregivers in the recovery process. Trauma is complex, and as we have just learned, it can present itself in many ways. Fortunately, SAMHSA, the Substance Use and Mental Health Services Administration, provides us with clear guidance for applying trauma-informed practices in school settings. Let's close by reviewing the 4 R's of trauma-informed care, which can help us anchor our work in shared language and purpose. While you may be aware of these principles, naming them explicitly helps strengthen alignment across classrooms, schools, and districts. Realization. Realization means understanding the widespread impact of trauma and how it may affect our students and colleagues. Realization starts with awareness. Awareness that what we may see on the surface is only part of the story. Like the iceberg model we discussed earlier, we must consider what's happening underneath: fear, grief, shame, or unmet needs. When we realize the scope of trauma, we prioritize both physical and emotional safety, and we build trust through clear communication and consistent boundaries. Recognition. Recognition is our ability to identify the signs of trauma in students. This requires us to stay informed and to notice the indicators we've discussed in this training, and to approach those observations with curiosity instead of judgment. Fostering a culture of peer support and staff collaboration also strengthens recognition, because when we work together, we're better able to notice patterns, compare perspectives, and to support students in a more coordinated way. Response. Response is about how we, as educators, can act in our classrooms or schools every day in a trauma-informed way. This means we collaborate with students by offering choices whenever possible, from how they demonstrate their learning to ways to cope with stress. We prioritize building respectful relationships where students' perspectives are valued. Our response focuses on empowerment by highlighting their strengths and abilities, fostering a sense of control over their learning journey. We actively give students voice and choice in their classroom activities and decisions, recognizing their resilience and other individual strengths. When trauma is present, we respond by creating safe spaces and providing referrals when necessary. Resisting re-traumatizing. The final R is about actively working to avoid practices and environments that could inadvertently trigger or worsen trauma responses. This asks us to be mindful of factors that may impact how a student responds in a learning environment. By having awareness of individual trauma stories, triggers, and students' needs, we uphold the principle of creating a truly healing and supportive school climate for all, especially students with visible or invisible trauma. Here are a few key takeaways. Trauma is present in our schools, across all age groups and communities. Understanding how trauma affects students' behavior, learning, and development helps us create more positive and supportive school experiences. Trauma looks different depending on age. Younger children may regress or act out. Older students may withdraw, take risks, or struggle academically. Remember, behavior is communication. Pay attention and seek support when needed. Respond with care and consistency. No matter your role in the building, you can use trauma-informed strategies to provide safety, structure, and support. Listen actively, validate students' emotions, and create a culture of empowerment. I'd like to leave you with a quote from Maya Angelou. Do the best that you can until you know better, and then when you know better, do better. This training is about knowing better. And now, as a school community, we can also do better together. Let's continue to support one another. Let's create spaces where students feel safe enough to show up, supported enough to take risks, and empowered enough to grow. Thank you for the work you do, and for your commitment to helping every student who walks through your school doors.